Hello, my colleagues and my friends and my fans. Today I will talk about an important topic in clinical practice, which is drug interactions. And the drug interactions is it has medical legal implications also in clinical practice because it is one of the causes of medical mistakes or errors which are done in clinical practice and may raise legal issues. And the drug interactions actually comes next after lack of communication among the common mistakes done in medical or in clinical practice. The lack of communication and the miscommunication is the commonest mistake done in clinical practice due to poor communication between the health carers and the consumers who are the patients, our patients. And this causes problems, and this may raise legal issues. And the miscommunication or lack of communication is the commonest cause of complaints among complaints against medical practitioners by consumers. Drug interactions is the commonest cause of medical errors in reality, as I mentioned, after miscommunication. So what is meant by drug interactions? Drug interaction mean a change in the way a drug acts inside the body when taken with another drug, or when taken with herbal, or when taken with a food or beverage, which should not be combined with it, or when taken in a specific medical condition in which it is contraindicated in this medical condition or disease to give that medication or drug. So this is the definition of drug interactions: change in the way the drug acts inside the body. What are the problems which might arise when this happens? The problems are one of three. Either the drug, one of the two drugs, which are the two or the three drugs which are combined by mistake wrongly together, and they should not be combined scientifically together. The drug may be more effective, and this increases the side effects and the toxicity of the drug, or one of the drugs may be less effective, and it will not produce its clinical effects, and we might have to increase the dose of this drug in order to be bioavailable and reach its target organ and produce its target clinical effects. So it may be that the drugs may be more or less active. This is number one, and this will nullify the efficacy or may increase the dose of the drug and produce side effects or even toxicity of some medications. So this is number one. And number two. Number three, it may also produce some unexpected reaction in the body, which might be lethal or dangerous, like, for example, bone marrow failure, or aplastic reaction, or hemolytic reaction causing intravascular hemolysis, or some sort of severe allergy like anaphylaxis, etc. So this is unexpected reaction is another sequelae of combining drugs by mistake. Then we come to what are the types of drug interactions. There are three types of drug interactions: either drug-drug interaction, when two or more drugs are combined together, and they should not be combined, these two or three drugs in practice, science-based. Number two, drug food interaction, and this is a reaction between drug and a certain food or beverage, which should not be taken when this drug is taken. So this is called drug food or drug beverage interaction. And drug condition interaction, this is an interaction between some drugs and a specific medical condition in which this drug should not be taken or combined when the patient has this medical condition or disease. Examples like drugs which are contraindicated in patients with G6PD deficiency, like the sulfonamides, like the any sulfa-containing medications, like some analgesics like paracetamol, nitrofurantoin, etc. Medications which should not be given to patients with G6PD deficiency because they might precipitate an acute intravascular hemolysis in such patients, and this might be also fatal and increase the morbidity and mortality. So these are medications which, if there is a specific medical condition, they should not be taken, and they are contraindicated in such patients. This is what we call a drug-condition interaction. So we have drug-drug interactions, we have drug-food interactions, and we have drug conditions interactions. What drugs which should not be taken together? Number one, 2 or more drugs which share the same active ingredient. We should not combine them because they might increase the toxicity or the side effects, of course, when taken together. For example, we take 2 medications which contain, for example, diclofenac. This is wrong. We take a medication which contain, for example, they contain a beta-lactam, like combining, for example, penicillin with cephalosporin. Wrong, because they are both beta-lactam antibiotics. So they contain the same active ingredient. Or combining 2 or more drugs which belong to the same group of medications. This is also wrong. Like combining 2 beta-lactam drugs, like combining 2 drugs which act on the active clotting factor 10 as oral anticoagulants, as the new NWACs. For example, this is wrong, like combining 2 medications which are DPP4 inhibitors used as anti-diabetic or anti-hyperglycemic in patients with diabetes, or 2 drugs which act which are acting on the incretin system, or 2 penicillins which belong to the same group, and we give them together to treat diabetes. So giving 2 drugs which belong to the same group is absolutely wrong. It should not be done, and this is a mistake. It might increase the toxicity or the side effects, and also will not increase the efficacy at the same time, and their negative effects will be more than their positive effects. So wrong to do such a thing. Don't combine 2 drugs which share the same active ingredient. Don't combine 2 drugs which belong to the same group of medications in treatment of a specific disease or syndrome, and we all know such medications. Also combining blood thinning agents, that is antiplatelets or anticoagulants with non-steroidal anti-inflammatory drugs. Wrong to combine, and it's a mistake to combine the blood thinners with non-steroidals, because this increases the incidence of bleeding, gastrointestinal bleeding, internal bleeding, cranial bleeding, etc. So wrong to do such a thing. Number 3, combining contraceptive pills with antihistamines. Wrong to do. They should not be combined together. Combining levothyroxine with proton pump inhibitors. This will decrease the absorption of levothyroxine, and we have to increase the dose of the thyroid replacement in such patients. Also combining SSRIs, which are antidepressants, with other drugs acting on serotonin in the nervous system, like trazodone or like tramadol. Combining these 2 medications together is absolutely wrong, and we should be careful. Also combining clarithromycin and other macrolides with calcium channel blockers, which is a group of blood medications. This is also wrong and should not be done. So these are all medications which should not be taken together, and we should avoid giving them together in the same patients. Some other examples of common drug-drug interactions we should be cautious, and we should remember them, is combining digoxin with verapamil. Wrong. Combining digoxin with quinidine, also wrong. Combining digoxin with amiodarone, dangerous and wrong. Combining warfarin with quinolones, wrong. Combining theophylline with quinolones, which is